good evening.
Happy March. Happy March Madness.
Yeah. March Madness.
Which we'll tell you about at the end. March Madness. That's all we gotta say. It's our code words tonight. We are gonna be doing a raffle at the end. We've got Xeomin, an area Xeomin to give away. And then we also have a really cute NeoCutis makeup bag to give away. And a ready for beach towel, NeoCutis beach towel with this little white fringe at the end.
Cute.
Very,
right?
very chic.
Chic. All right. So we're gonna start in a few minutes. What are we talking about today?
We are talking about aging in reverse, turning back the hands of time.
Just want to put a stop on them and just not even.
They're not moving.
I just want
They're
to
not
breathe this time.
moving.
Yeah. Can we do that?
I can't go anywhere. The clock is stuck.
A
It's
beautiful
gonna
day.
Be stuck at Renew. It's like Groundhog Day. You look the same every day, or better, right?
Or better.
All right. How are we doing there? Are we getting on?
Yeah, wait a second.
Perfect. We're ready. We're so ready.
You guys are probably noticing Dr. Barrett's tattoo work on her face.
Oh,
Looking very tribal.
I'm looking tribal. I've got my Nubian princess look today, right?
Yes.
Yeah.
A Nubian princess. I have little brown dots soon to be on my lower lids. And in a month, starting in a month, then ending in 6 months, I will have had a non-surgical bluff.
Absolutely.
Right, Ashley?
Absolutely.
That's so cool.
Thank
Courtesy
you.
of her plasma pin treatment, which we just completed about 30 minutes ago.
Yep.
And so the little dots that are under her eye were created by the plasma pin, which uses plasma energy to treat the surface of the skin as well as the dermis. So what it does is it produces collagen, which we love, speaking of aging in reverse and the fountain of youth,
Collagen
aka
buzzword.
collagen. And it also smooths fine lines and wrinkles, and it tightens beautifully. So the little dots that are under her eye will turn into scabs in about 5 days, and then they'll fall off, and she can resume, if she'd like, to wear makeup, and that area begins to tighten visually in about 1 month.
So 7 to 10 days for makeup. So once
Yes.
the dots are off, right?
Mm-hmm.
And then you have a little kit to give me?
Yes,
Okay, perfect. Don't forget.
I will not forget the kit.
My kit.
The aftercare is really quite simple. There is a cream that's applied as well as a powder which is made of volcanic ash, which sort of speeds along the healing process, the process of the little dots turning into scabs. And as you can see, the treatment, it's not a tough one. She's ready to go
It's easy.
within 30 minutes.
I mean, it took us, I think, 8 minutes to do the treatment. And it's a little spicy, but not bad. I mean, because in 8 minutes, you can do anything for 8 minutes, right? I mean,
Yeah, for sure.
Yeah.
Well, I mean, and I was there for it, and you were just hanging out. We're just talking. You're just literally aging in reverse. Just getting this cool henna tattoo on your face. It's really neat.
it is great. I'm so excited because honestly, when I look in the mirror, that's my big thing.
Mhm.
My under eyes is my big thing. And I always said, I'm going to have surgery. That's the only surgery I will do. And now with the plasma pen, I don't think I'm going to need surgery.
No.
I mean, I think it's going to be fabulous. And I went a little, I didn't let you get too aggressive because I didn't want to be too swollen. But, I think it's a great way to do it. My lower lids, I'll probably do possibly my upper lids later. They're not too bad, and then a little brow lift. So this is aging in reverse. Aging in reverse.
So we can
Live
do
example.
lower lids, upper lids, and a brow lift.
Mm-hmm. Yeah. And she did my little crow's feet, so they will be gone. All right. So we're talking about aging in reverse, and this came to me because I started looking at my patients. I've been doing this for 22 years, and I started looking at my patients and pulling up their pictures from when they first walked in my office. And then I would show them because sometimes they get a little discouraged. Like, oh, I'm looking so old, and yeah, they're older, but they feel like they're just looking old. I pull up their old pictures, put them together, and it's like, holy moly, honey. Listen, Linda, When you walked in this office, you looked like this, okay? And now today you look like this. That was 10 years ago, and you look younger than you did then.
Which is crazy.
It's crazy. Yeah, so I mean, so we want to tell you the secret. We want to
And
tell
what are you
the
doing that they're looking younger 10 years
secret
later?
sauce. Oh, it's incredible. It really is incredible. I always say, you're gonna look younger than than the day you came in here. Because many times, sometimes people have done a lot of things before they get to me, but majority of the time, not a lot, and they just are lost in the whole realm of the aesthetics, I think. They don't know what to do. They don't know what Botox is, there's filler, they just don't
Really, there's
understand.
Botox alternatives, we've got Xeomin, we've got Dysport, I agree, I think there's a lot out there, there's a lot of information, and while there is a lot of information and we can look at different things, it can be very overwhelming, right? So it's like, what do you ask when you come in? What are clients asking you when they come in? They're like, okay, well, I always hear them, they're like, Dr. Barrett's skin is beautiful, what is she doing? And they always use you as an example, and they come in and because you have a very natural appearance, and that's what they want. They don't want to look overdone, right? Like no one wants to look like they've had anything done. You just want to look like you, but better.
Right. I think the biggest thing I hear all the time is I want to look refreshed.
Refreshed.
I feel like I look tired, or I feel like I look angry. I just want to look refreshed. And they always cite things like, I see these women with big cheeks, and I see them with big lips, and I can tell they've done stuff, and I don't want that. I really don't want that. So don't you find that?
Yeah, I feel like everyone says that, especially new patients, they come in, they're like, oh yeah, like you said, like I feel like I look tired, I want to look refreshed, I want to look like I got a good night's sleep even if I didn't,
Right.
but they're very afraid to look
Done.
full and overdone, full in the lips and the cheeks and all the places, and it's like, that's not what anybody really wants. You don't want.
You want to look like yourself. And one
Right.
thing that you do often, Dr. Barrett, is you ask patients to show you a photo of themselves a couple years ago. So that way, all of the treatments that you're doing are in alignment with the natural shape of their face.
Yeah, and it's pretty easy. I feel like the way that I inject and the way you inject, we're actually following your anatomy. So we're following your bone structure. It's really hard to go wrong. So when you use that formula, it just makes it look like you used to look. You don't look different. So sometimes people will say, my husband didn't notice. And I feel like that's because when you're with somebody a long time and they're watching you age every day, they don't see it. And I feel like in their brain, they just have implanted that you were 10 years ago, 20 years ago, 30 years ago, or even 2 years ago. And that's what they're seeing when they look at you. They don't see the aged you. So a lot of times when I pull back people in time, we give them back their lift, and we give them back a little volume in their lips, and we tighten their eyes and tighten their skin. People don't really look, they don't say, what'd you do? They just say, wow, you look rested.
Yes.
You look good.
Always
look
the goal.
happy. It is. And I think that's a big difference for our practice. I mean, how many times, probably even just today, we hear, went somewhere, I felt overdone, I didn't like it, they didn't address what I wanted.
I don't look like myself.
Yeah.
We hear it all day long. And the nice thing is that we can do things to either get rid of it, which I don't like to do, but I can put things in the right place to soften it, so that it's really nice. So when we're aging, we have to, I think, first, to know how we're gonna get back to what we used to look like, we have to talk about how we age just a little bit. So Ashley, what's the one thing that you see a lot, as a laser tech, esthetician? What do you see with these patients who are aging?
So what I notice is the emergence of fine lines and wrinkles. And, with the source of those fine lines and wrinkles being the recession of the foundational support that the bones provided. As we age, our bones sort of shrink, and the foundational support that we once had sort of dwindles away, which causes lines and wrinkles in this area. I also see a lot of sun damage for our patients who have not persistently used their SPF, as we always encourage them to do every day. And I see changes in the texture of the skin that can commonly be addressed with, the correct skincare. So that's some of the things I see on a daily basis.
Yeah, so sun damage, volume loss, which could be bone, muscle, fat, and those are our structural support. So when they go, that's why things fall down. I would say gravity is the same number as it was when we were born, right? It hasn't changed. It's not gravity. It's not gravity's fault. It's that we don't have the support that we used to have. So that's the biggest change. So those changes, and then so skin, the loss of elasticity, and then we have our overactive muscles, right? So when you know what things, overactive muscles, what do you see a lot? You kind of explained it a little bit from overactive muscles.
I'm extremely aware of the fact that I, at rest, frown. I don't ever remember doing this. I've never been conscious of it until I turned 30, and now all of a sudden I'm caught myself in the mirror or in the back of a picture where I'm not the front, I'm smiling, and I'm still off to the side, and I'm just frowning. I'm why am I doing that? So overactive muscles, I'm thinking the DAO muscles, which is something that we treat with neurotoxin, the weird way that we move our mouth, and we pout our chin out, and we wrinkle our chin, and we get this orange peel effect, which we also treat with neurotoxin. Just all of these overactive muscles can really contribute to the way that your skin is being pulled over time. And so if your muscle keeps pulling it, then the skin will eventually, in cahoots with gravity, will go that way. And it's oh, this is such a sad story, but luckily,
but it doesn't have to be.
At Renew we
that's
fix
what
this.
we're here to tell you.
That's
It
right.
doesn't have to be. So these are all the ways that we age. So we talked about
how do we stop it?
how we age, how we approach aging. We talked about that we ask people what bothers them and what they want to achieve. So they want to be natural, and that's kind of what we shine at. And then we want to talk about our tools. So these are our magic wands, and anybody who's ever been injected by me knows I'll ask for the magic wand, and the patients are like, yay, she's gonna use her magic wand. Well, it's not actually, my magic wand is for something different, it's to stop bleeding, but
Right.
because usually by the time it gets out of the drawer, the bleeding stops. So. But we do have magic wands that are our tools, so we're going to talk about that. And I didn't introduce everybody, but obviously Dr. Barrett, and this is Ashley, and she's our esthetician and our laser
Technician,
tech,
if you want.
and she is our just machine guru. And then we have Gretchen Gigi, aka, and she is our nurse practitioner, and she's going to be heading up our Renew Miami,
Which is very exciting. So exciting. Yeah.
So she's up here training how to run Renew down there, very similar to Renew up here.
How to stop all these horrible things that we've been talking about bone recession and collagen loss.
Right.
And
We're gonna stop it in Miami.
yes.
Everybody's gonna get renewed in Miami.
Sounds good to me.
So I'm gonna ask Ashley, what are your favorite tools for aging in reverse?
So my favorite tools as far as machines are concerned,
You decide, but
So,
you're the machine guru. So.
as we've discussed, collagen is key. Collagen is key when it comes to anti-aging. And unfortunately, as we age, we produce less collagen. So the sooner that we get collagen induction on board, the sooner that we stop sort of that progression, that visual progression of aging. So let's start at the deepest level. So at the deepest level, the treatment that I recommend, our heavy lifting treatment, is Ultherapy. So with Ultherapy, it's customized and it's tailored, which makes it unique. It's also unique in that it treats at the deepest level amongst all of the machines. Laser, microneedling, radiofrequency, Ultherapy treats at the deepest level. So what it involves is I first scan a patient's tissue to see how deep their collagen runs, how deep it lays, and I send heat energy to that deepest level which is the SMAS. That's where muscle meets the tissue. That's where plastic surgeons target when they're doing a facelift, thus heavy lifting, and it beautifully produces collagen, and in turn, it lifts, the heavy lifting machine. And if we move a little bit upper in the dermis toward the top layer, laser, 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 laser. Laser is skin, it's a skin resurfacing tool. And what it does as it resurfaces is it targets those pesky sunspots that I mentioned earlier, the fine lines that I mentioned earlier, and it's going to tighten pores, it's going to smooth under eyes and tighten lids, and it does so with very little downtime, 1 or 2 days max. Where you appear as if you have a sunburn, maybe you fell asleep on a boat, you could go with that story.
Sounds good.
Yeah, you could go with that story.
Happens.
And the next day you can wear makeup. So it doesn't get much easier than that. Microneedling, moving a little bit up in the tissue, AKA collagen induction therapy, it all goes back to collagen. All goes back to collagen. It helps to induce collagen production, and it's great for resurfacing the skin, producing collagen, great for acne scars. We have a heavier duty microneedling, which is microneedling with radiofrequency. It tightens the skin as well as producing the collagen. And all of the treatments that I just listed, I'm not sure if we'll get into exosomes later, but they can be paired with exosomes for a fantastic result. Exosomes essentially it's PRP, but on steroids, much more potent, much more stronger, reduces healing time by 50%, and increases the result.
Wow, you are so eloquent.
I know. Someday I'll be able to speak like
I
Ashley.
know.
It's the excitement. It's the excitement because the products, the treatments, they work.
Yeah, and you're perfect at explaining them and how they work and why they work and, to everybody out there, so everybody can understand. So we were just talking, like, I think a lot of people just don't understand these things.
They
So, I think that's super. So these are all our machines that we have in the office. And, we'll talk a little bit, like, in a minute after we've kind of gone through the tools, but, there's a lot of choices on how you want to approach your aging in reverse. And it doesn't just have to all be fillers and needles, but let's talk about fillers and needles. Let's talk about injectables.
That's what I like. Sometimes I like to say nothing will make you feel better except putting a needle in your face. So filler and neurotoxins are some of my favorite things. Just to, I don't even want to say like initiate your aging in reverse, but like one of the first things that people do is usually some type of Botox. They only know Botox because of branding, but there are alternatives. We also have Dysport and we have Xeomin as well. These are kind of like where I feel like most people start. Like you've probably had a facial in your life, and then as time goes on, you will move into some type of Botox or Botox alternative. So we start there and then progress at some point in what seems to be younger now with filler, whether you start with your lip, it's not necessarily always needed for people, or you start with some type of, as Dr. Barrett was saying, like a lift. We'll start with like a mid-face lift that will help with like jowling, which is something that I feel like we see pretty early in people, as well as provide more structural support to the mid-face, which again helps to lift here. So those are some of my favorite things.
Yeah, injectables are, that's your quick fix. It's your immediate gratification. So we talked about machines. Machines are awesome, and machines, work amazing, but they take time. So we're talking like 1 to 6 months to see results. So a lot of times by the time somebody comes in to us and they're wanting to look refreshed and natural, they want to see a difference pretty quickly, and that's where injectables shine. Right away, put a little radius in, and I always say it's what you do in the mirror at home all day long, where you're like, here I am, I look better, if I can just stay this way.
Or that selfie pose with
Right.
the camera that's
Right.
above your head,
Here I am.
where gravity is lifting you.
So but that's what radius does. It just tacks it up and leaves it, so you don't have to walk around like this. It's just great.
Like a nice tight ponytail.
Yeah, it is, the ponytail lift.
Instant gratification.
We can
Love
do that. We can do our temple lift, which is, I don't think there's hardly anybody
No, I feel like that's a Dr. Barrett trademark for
in
sure.
town who are doing this, and it's just sliding up here, depositing a little bit of fill here, and it's just lifts you up like a ponytail would. So you have lifting all the way up, very natural, you didn't add volume to the face, you're gonna look very naturally refreshed, and people love that. Because no downtime, no pain, and instant results, and natural. Like, you can't get more natural than that, and it's beautiful. So that's something that we only do here at Renew.
Like,
So that's
that's so
our
funny.
tempo lift.
That you said like no downtime, and everybody's always concerned about downtime. And the first time I saw you do a tempo lift, which I had never seen before, never even heard of it, that patient was going to dinner that night, and I was like, how are you gonna go? Why would you come for like a medical procedure the day you're going to dinner? And she left, and she looked amazing, and it was
It's one little dot right there,
Instant.
and that's it. And it's one little needle poke there, and that's it. That's it, an instant, beautiful. And it's really good for my patients that don't like a lot of needles. They have a lot of low pain tolerance, because it's just one poke on each side, and it doesn't hurt. It's just, cannula, easy. So that's a wonderful trick, little renewed trick we have up our sleeve. We have to talk about skincare.
Yes.
So skincare is really important. And so when I started all this 22 years ago, I had Botox and skincare. Actually, I didn't even have Botox, it was skincare. Then I got Botox. So I started with seeing that amazing rejuvenation that you could get with good skincare, where you're using a good cleanser, you're using a lightening cream, you're exfoliating, you're using a retin-A to stimulate your collagen again. It's all
Collagen,
about poking that
collagen.
bear, stimulate that collagen. And then a good medical grade sunscreen, so that you're not damaging your skin every day. And that gives amazing results.
Absolutely.
Amazing. So if you do nothing but just decide to wear sunscreen, you're gonna see improvement in your skin.
100%.
medical grade sunscreen, right?
Medical
So I
grade,
get
not
this
Walgreens,
question a
just
lot.
CVS.
I get what is like, okay, I'm using SPF, I'm using a cleanser, blah blah blah. And we're like, okay, but is it medical grade? So how do you explain the difference in like why people need medical grade rather than
So-
just going to Walgreens?
Medical grade is tested, the chemicals are more pure. I actually like mine doesn't really have many chemicals. You can have chemical block, or you can have physical block. And I really prefer the physical, the zinc and titanium. And in the old days, you would look white, so nobody wanted to wear those, but now it's all micronized, so it's really smooth and it's easy. And you can easily put it on. It's so effective, so much more effective. It's hard to get in the drugstore. It's hard to get the right percentage of zinc and titanium in your products. And then they put a whole lot of other chemicals in there. So you're just not getting the same. It's actually probably damaging to your skin more so than helping you. And you see a lot of people, they say, yeah, I wear my sunscreen every day, but they look tan as heck.
Right.
It's obviously not working, or you're not wearing it. So, it makes a difference. So skincare, machines, Botox fillers, threads. I'll talk real quickly about threads. I do like threads for certain people. I do my threads, like everything else, differently than most patients or most doctors do. So my threads, instead of pulling you from here, are gonna go in here, and they're gonna really lift you up. They're lifting the fat pad, they're lifting the deeper tissue instead of just pulling the skin, which is what the other threads do. So I find they're much more effective. I love them for patients who either eat through fillers, patients who have a very full face and we don't want to add more volume, patients who want a more robust lift. But I do say that I'm not finding they're lasting that much longer than a filler. So it just depends. And I think it's super important to talk to the patients about what they're expecting. They come in saying, I want threads. It's not because they know anything else except what they see on Instagram, what their friend told them, and actually most of the threads out there that are the just lifting the skin threads, they're only lasting 6 months.
Very true.
Why would you not do a filler? My fillers are lasting 9 to 12 months, sometimes a year and a half. So but the thread I put in, it does last a year. So it lasts a year to a little more. So threads, that's, my take on threads. It's all about coming in and finding out what's right for you. So, and maintenance, okay? So these patients aren't coming in 10 years ago and then coming back 10 years later. They're coming in once a year about to maintain. If they're on a neurotoxin, they come in every 3 to 6 months, just depending on how long it lasts. So, but even if, some patients say, I don't want Botox because it only lasts like 3 to 4 months and I don't want to come here that often. And I always tell them, even if you came once a year and did your Botox, that's 3 to 4 months out of your year that you're not making those wrinkles and making those lines.
Mhm.
So even if you do it once a year, let's say you let your movement come back, it's still gonna help. So once a year at least to come in and see me, that's not a big deal.
Not at all.
You do your mammogram once a year, you see your doctor once a year.
Oh, hanging
Do
out with the
a
Renew
lot of-
Girls is way more fun than that.
Absolutely.
Of course, yes.
Absolutely.
It's a funner time, so.
I think one thing that's important to note that a lot of patients are not aware of is that when you repetitively move muscles, you create static lines,
Mhm.
meaning Botox is preventative. So the lines that you see when you're at rest, in order to prevent those, you would use a neurotoxin like Botox, Xeomin, or Dysport to minimize that movement and prevent the lines from being created in the first place.
Right, so prevention is key, and then maintenance is key too. So like I said, just once a year if you want to, but I think it's better. Most of us that use Botox, it's like once we start getting movement back, it's so addictive.
Done.
No, I don't want that movement. I want to be, what did you say? You want to
Frozen like a monument.
Just like a monument.
Like a
I want to be
monument.
just like a
Right.
monument.
People hear that and then they go, well, that's not natural looking. I mean, look at Ashley, look at Gigi, they look natural. I have a little more movement.
And that's
because mine
fine.
doesn't-
But
mine doesn't
everybody's
last
preference
long.
is
That's
there's
right.
always
I wish I could be a
preference.
monument. It just doesn't last long enough for me to be one. But, and that's the thing too. Everybody's body is different. So everybody's going to respond differently to these, and you have to know that. You have to be told that. So, all right. So there's no single magic potion. So my big thing about this is combination therapy. Okay, there's not one thing on this list here that I would say just come in and you're going to do that one thing and you're going to be so happy, because it just doesn't work that way. We talked about that in the beginning. You have to take care of your skin and your sun damage. You have to take care of the deeper tissues and tighten and lift. You have to replace that volume. It all works in concert.
Absolutely. It's like a recipe. There's more than one ingredient.
Oh, yeah.
Always.
That's perfect. I love that.
And we didn't even talk about one of your favorite maintenance magic wands.
Oh yeah, we didn't talk about our
Sculptra.
favorite connection. Oh my gosh, yes, Sculptra. And then I was thinking exosomes.
Oh,
So yeah, Sculptra is amazing because Sculptra is an injectable. Doesn't give you instant results. It takes like 6 to 12 weeks to see your volume, but it's going to build your own collagen. And a lot of people like that because if they want to be natural, this is going to do it for them, because we put it in, the product's gone within 6 months, but your collagen's going to stay for 2 to 3 years. And it just naturally revolumizes that lost volume.
it looks so beautiful.
It's beautiful. And then
Very natural.
we can dilute that and radius, and we can do neck washes and chest washes. We can do lasers and tightening on the chest and the neck. Just keep working our way down because you want to match. You want to make sure your face matches your neck and your hands. You want to make sure everything matches.
And it's a wonderful complement to naturally volumizing the face and including the temples, which are oftentimes left out.
Yes.
Yeah.
And as we age and as we lose that foundational support and things sort of start to fall down, the loss of volume in the temples can sort of jump out.
Yeah.
And so it very naturally and beautifully just fills them in.
And the Sculptra is the only thing that I like to use in temples. I know a lot of other doctors put other things there, but just for safety reasons, it's a very complicated anatomical area. There's a lot of very important vessels there, and Sculptra is a liquid, so when I'm in there, I can check the safety. And even though there's a safe space to go in there, I've been in there with Sculptra and even then noticed, no, it wasn't safe. And then with Sculptra, you just change the needle out, and, you go and you check another spot. But if you have a solid filler, that could be very dangerous. So for safety reasons, I love Sculptra there, and it takes a little longer, but it just revolumizes. It's a fat loss issue right there. Fat loss issue completely. So the exosomes, real quick, we'll talk about, because we didn't talk about one thing that helps you rejuvenate. I think a lot of people have been losing hair with COVID, from COVID, from the
Absolutely.
stress of COVID,
Uh-huh.
from the vaccines. Whole reasons, and exciting news about how we can treat hair loss, which we used to do with PRP.
Yes.
And I'm sorry, it hurt like Hades. It looks horrible, I've had it done before, and now we have something great and new. You wanna talk about it real
Exosomes.
quick?
Exosomes are phenomenal. So exosomes are derived from a human source, and just to clarify, they're not taken from a human source and then applied topically to the patient. They're replicated. And so just to back up and discuss PRP, which they're actually replacing, PRP is platelet-rich plasma, and it's pulled from a patient's blood. A patient's blood is drawn. It's put into a centrifuge and spun at a high rate of speed to separate the PRP. And then that is injected into the scalp for hair growth, and it can be applied topically after a laser or microneedling to enrich or better the result. Now we are using exosomes. There's so many amazing innovations in aesthetics, and at Renew we do our due diligence, and we're excited to be using exosomes because of their results. So exosomes will cut healing time by 50%, and they also help to enhance the production of collagen. They're nanoparticles, so when they're applied topically after a treatment, they seep in very easily into the skin, and they're attracted to inflammation, and they bring it down, and they improve the results. So how can you use exosomes? The most minimally invasive way would be with just a dermal roller, like what you can use at home in front of the TV or when you're relaxing to stimulate collagen. We can do that in office and apply the exosomes. Going a little bit deeper, we can apply them after microneedling for phenomenal results.
Yeah, I like that.
We had a patient who came in and we treated her for her main concern, which was perioral wrinkles. Within a week, she came in for a different treatment, and we put the before and after side by side, and you could see a significant reduction in those wrinkles, and this is just after a week.
And she was 84, by the way.
Yeah, she was
Yeah.
84 and
So-
pleased with her results. We can also apply them topically after a laser. And once again, it's going to bring that healing time, which isn't extensive, it's 1 to 2 days, but it's going to reduce it down to 50%. And it also enhances the